As kinesiologists, we need to understand that we need to know the significance of exercise barriers and adherence. In our population today, there's a decline of physical activity when people reach adulthood, and so this leads to obesity, and this is a serious health factor because physical activity actually reduces cardiovascular risk, and we can see that the workplace is not a place where a healthy lifestyle can be sustained, and so we need to come together as kinesiologists to educate people about the benefits of exercise and to move past those barriers by motivating people and understanding the costs of not being physically active can really impact our society. As a future occupational therapist, there are many barriers that people will experience to participate in physical exercise. So, I will be seeing a lot of patients that have disabilities and things that interrupt their daily life. And so, these are some diseases that the textbook talks about, and they actually all say that exercise improves the quality of life and actually helps with symptoms of these diseases.
So this can apply to both Noah's and my career of wanting to become athletic trainers. Now, to define an athletic trainer, they are healthcare professionals who collaborate with physicians. The services provided by ATs comprise prevention, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation of injuries and medical conditions. Now, being the athletic trainer, you are going to have to face and help your patients overcome any type of injury related barriers and encourage them every step of the way. Injuries act as barriers to exercise, and slow recoveries impact an individual psychologically and can prolong the time before returning to physical activity.
So this is the important definitions that you need to know regarding our topic. So we have exercise adherence, self-efficacy, health belief model, subjective norm, self-motivation, association, dissociation, and motivation. So these all have to do with what it means to be able to continue exercising or barriers that prevent people from exercising. And I included a photo of the health belief model, which I'll define in a moment. The first step, exercise adherence, is just sticking to or remaining engaged in physical activity. Self-efficacy, an individual's belief that he can successfully perform a desired behavior, so it's like confidence. Then you have the health belief model, which is a theoretical model that illustrates how and why an individual considers the possible health outcomes and like they determine if they want to do it or not. Then you have the subjective norms, self-motivation, association, and dissociation, along with motivation. So this just all has to do with why somebody would or would not participate in exercise, as well as keeping a discipline to do it or not. So moving on.
Now, here are some barriers to physical activity. There are many different types of variables that are considered to be barriers for physical activity. So there's personal, physiological, environmental, and psychological. Now, for personal, some examples include insufficient time to exercise, not being able to afford any type of membership, and or just exercising being an inconvenience. Now, for physiological barriers, some examples are being of old age, having a chronic disease, and or something eternally that is preventing you from being able to physically be active. Now, for environmental barriers, some examples are lack of encouragement from your friends, from your families, the path to the gym is closed or to the trails are closed for hikes and walks. Now, for psychological barriers, some examples are you're lacking some self motivation, or you're not enjoying the workout anymore, and you just lose confidence in yourself. Now, many people struggle with one or many more of these types of barriers. Because of these barriers, it is blocking so many people from living a physical, active, and healthy lifestyle.
Even though an overall healthy lifestyle improves mental health and helps control overall weight only 32% of Americans actually participate in vigorous exercise. So we can see that there are different influences on the workplace, including social influences. We can also see the organization influencing skill development and also the way they come about a healthy lifestyle. So we should see workplaces reduce barriers and increase facilitators of increasing the amount of motivation to live a healthy lifestyle.
All right, so what we have here are interventions and treatments to exercise adherence or barriers. So this is all mostly just going to be positive things that will help people continue to exercise, or positive things that will break down the barriers of people who do not exercise. So first up, we have reinforcement and rewards. So it's just a great influence in promoting exercise. When people are exercising, you just reinforce them, give them rewards for the exercise to show them that their work will pay off. So cues include things such as "you're doing great" or "great job," "you're doing excellent." So another one would be the variety of activities. So it makes it more enjoyable when you have plenty of things to choose from instead of the only way I can exercise is to run on a treadmill. But when you have studies show by Givenchy Helsa in 2013 showed that when participants have a lot of choices, a variety of activities to um, act, be active in, they have a lot more higher levels of happiness and are more likely to exercise. So just having a plethora to choose from, like multiple sports, so yeah, it increased their exercise participation and enjoyment without altering their perceived exertion. So that's just how much effort they put forth and how exhausted they became. So another intervention is going to be social support. So this could just be a teacher, class, or buddy that enhances their adherence. So according to Martin 1984 study, small social groups increase attendance, participation, and cohesiveness. So this can be done through group exercise or just teams exercising together, or even having a workout buddy that will help people remain consistent. So next slide. So a few more interventions and treatments include goal setting and behavior modification. So this is just to piggyback off the last slide. It's just continuing what helps people remain engaged in exercise, or what breaks the barriers for people from physical activity. So according to the textbook, goal setting, 47% of people who set goals were still exercising 3 months after a program ended. So in this study, a lot of people began a program, but only 47%. Out of them, the people who continued exercising the longest had set goals. So that's even after a program ended. So they just were able to continue to work on their own because of the goals. So the last one we have is behavior modification. So motivational interviewing is a brief psychotherapeutic intervention that's very likely to increase one's willingness to participate. So in this situation, a counselor talks to a client, and then they'll have some sessions together, and as a result, the client's motivation towards pursuing a healthy lifestyle will grow. So it's just behavior modification. It's just interviewing one-on-one. So I included a photo up top to the right, kind of is like what this is like. And then I just inputted a few more pictures with groups exercising and one person reaching for their goals. So that's just to illustrate what I've been going over. So moving on.
So, due to the many different types of barriers that prevent people from working out and having a healthy, active lifestyle, it can have a real psychological impact on people. Now, these psychological impacts include losing confidence in yourself, hating your body, hating your self image, hating yourself, even, eating disorders, which can lead to obesity, just overeating, finding comfort in food. And then there's a total opposite, which is anorexia, which is you're trying to lose all this weight, trying to get the number off the scale as low as possible, and always thinking that you're just fat, which then leads to depression. And what's hard is that all these types of impacts are just continuing in a cycle.
In order for us to understand exercise adherence in the eyes of an athlete, we must create a positive experience as a coach. So, these are some things that the textbook says in order for us to do that. As college students, we can understand that it is a unique time where we get to decide whether or not exercise is important. And so these are some common barriers that we see among college students. And we also could see that people really care about their appearance while exercising. And the reason why they exercise is behind the physical attributes of exercise. And so we can see that it is understand to educate others and also enforce the significance of daily exercise.
Okay, so we have some Christian worldview. So another perspective on exercise adherence and barriers. So first up we have 1 Corinthians 6 verses 19 through 20. So this is talking about how your body is a temple. You're not your own body and you were bought with a price. So with it we're supposed to glorify God. So this is an easy reminder to be healthy, take care of your body because it's not ours, but it's from God and for God. So we're supposed to glorify God with our body. We can't do this if we're just not exercising and we don't maintain a healthy lifestyle. So this next one's sort of opposite ideals. So 1 Timothy 4:8 talks about, for physical training is of some value, but godliness has value for all things, holding promise for both the present life and the life to come. So this is kind of big picture. It's not all about exercise. However, physical training is of some value, so it is important. However, it's not the most important thing in life, and you have to remember that. You can't be judging people, criticizing people because they're unhealthy, when exercise is not the only thing to life, and that's important to remember. Last up, we have another verse in 1 Corinthians chapter 10, verse 31. So whether you eat or drink or whatever you do, do it all for the glory of God. So this is sort of like the first one we referenced, but it's just remembering that everything we do should be for the glory of God. So you shouldn't be working out just trying to make your own body look good, but you should be able to give God the glory in everything we do. So exercise is not about becoming chiseled or boasting about our own, but we're supposed to honor God, and with it, through exercising, it shows discipline and respect for our temporary physical bodies. So we can glorify God through that hard work and then being active with others. So yeah, just living a healthy lifestyle will show a great example to others and can open the door for spiritual discussion. So just remember to be diligent, and that'll highlight our recognition and submission to the Almighty God. So
for our current event story, we chose Kevin Love, who is an all-time All-Star professional basketball player for the Cleveland Cavaliers. And in this video, he talks about what he struggles with, which is anxiety and having panic attacks, and how it affects so many people around the world, no matter who you are and no matter what age range you're in. So Kevin Love speaks about how his agent was trying to make sure if he was up to doing this interview because people would talk about him. And Kevin Love said that he did not care at all if people talked about him, whether it was good or bad. He just wanted to be able to help people, to be able to help one person, one kid, and hearing what he has to say can be a total life changer, lifesaver for them.